Good afternoon, everyone. My PhD topic is the effect of obesity on the progression and outcome of acute inflammatory diseases. I am Dalma. Originally, I am a political scientist and a healthcare manager, but currently I am working as a clinical trial manager at the University of Pécs Institute for Translational Medicine. My vision is aiding physicians in risk assessment and decision-making about obese patients, and to be able to do that, our mission is to comprehensively address all factors related to obesity to better understand the way they interact with each other. We have already conducted a meta-analysis in this field that investigated how body mass index correlates with severity and mortality in acute pancreatitis, and this meta-analysis was published in 2019. As a continuation of our previous work, we took other related factors into consideration, and now we are investigating the effect of metabolic syndrome factors on the outcome of the same disease. As my second project, we will be investigating these same 4 metabolic syndrome factors, but in this case on the outcome of COVID-19 infection, and we are planning to do a registry analysis. So at first, let me introduce my first topic, investigating the effect of metabolic syndrome factors on the outcome of acute pancreatitis. The mortality rate of acute pancreatitis can even be 50% in the severe form, and as the incidence of obesity is increasing, the prevalence of metabolic syndrome is between 20 to 25% in the Western countries. Earlier studies have shown that metabolic syndrome factors are associated with a more severe disease outcome in acute pancreatitis and also higher healthcare costs. These previous studies have shown that obesity and hypertension can lead to a more severe form of pancreatitis and mortality, while pre-existing diabetes and hyperlipidemia were shown to be increasing the risk of complications. It may seem like we have sufficient data in this field. However, these previous studies were either meta-analyses investigating only one factor and with a high heterogeneity, or either cohort studies with a small sample size. So our aim in this case is to do a comprehensive analysis investigating the individual and also the synergistic effects of these metabolic syndrome factors on the acute pancreatitis outcomes. Our clinical question is how metabolic syndrome factors affect the outcome of acute pancreatitis, and the 4 exposures that we are investigating is obesity, pre-existing diabetes mellitus, hypertension, hypertriglyceridemia, and we would like to see how they affect mortality, severity, and the rate of complications. Our hypothesis is that metabolic syndrome worsens the outcome of acute pancreatitis. And with the results of our study, we are hoping to improve the prognosis of patients, improve patient education also, and aid decision-making in the emergency departments regarding patient allocation at admission. We have conducted a systematic search in 3 databases with a search key of 2 domains, one about the population and one about the investigated exposures. Our research yielded almost 20,000 articles, and after the duplicate removal, we have checked 16,000 articles for title and abstract. We have just finished the title and abstract selection, and currently we have more than 400 articles that we are going to do the full text selection on. My second project is investigating the effect of metabolic syndrome factors on the outcome of COVID-19. As we all know, the mortality rate of COVID infection ranges between 3 and 7%, and this clinical representation ranges from a symptomatic infection to mild respiratory tract symptoms to even severe pneumonia and multi-organ failure. And earlier studies have shown that comorbidities can lead to a more severe disease outcome. Furthermore, as I already mentioned, these 4 metabolic syndrome factors are major risk factors in many other diseases. A meta-analysis that was conducted in this field showed a linear dose-response relationship between obesity categories and the COVID infection outcomes. So with this study, our aim is to comprehensively analyze the combined and synergistic effect of metabolic syndrome factors on the outcome of COVID infection. Our question is how metabolic syndrome factors influence the outcome of COVID infection, and we are investigating the same 4 exposures that we are investigating in the first study, and in this case we would like to see how they influence the need for ICU admission, the need for mechanical ventilation, disease severity and mortality. Our hypothesis in this case is that more from the 4 metabolic syndromes are present, the worse the outcome of the COVID infection will be. The clinical implication is this study is to improve risk assessment of patients, and we hope that the data could be incorporated into prognostic scoring systems. For this registry analysis, I will be using the same registry that Luca has already introduced. This registry contains almost 2,000 patient data from 6 Hungarian and 1 Croatian center. So in summary, we would like to quantify the prognostic value of metabolic syndrome factors in the first case in acute pancreatitis and secondly on the outcome of COVID-19. And we are planning to publish both papers next year. And this is not the first time for me to do a work that requires several months of work before we have any results. But as one of my supervisors said, late harvest does not mean a bad harvest. So we are hoping that this time will also worth the weight and the effort from us. Thank you very much for your attention.
So late afternoon is not a bad afternoon. So questions, please, from the audience.
And to handle those who were immunized. And because, you know, immunization does not prevent or does not necessarily prevent COVID infection.
Yes, so the registry has a follow-up of patients, and we will have data on who is immunized and who are not, and we can make a subgroup analysis on those patients, and we can analyze them individually also.
Great lecture, thank you. So one little suggestion, or just I'm curious, based on my limited knowledge on metabolic syndrome, isn't hyperuricemia a part of metabolic syndrome, and if it's so, why doesn't it contain in the exposures? Thank you.
Thank you for your question. This is a very nice point. So metabolic syndrome is defined differently in the articles that we have found. The most commonly used definition is the International Federation for Diabetes definition, and it does not contain this factor, so we use that as a basis. But if we find articles that are mentioning this factor also, and if we have enough data to analyze this factor also, then we are definitely going to do that. Thank you very much.
If I may, one question. Regarding your first topic, you have several exposures that could easily overlap each other. So how the articles report this? Do you have raw data just for obesity with hypertriglyceridemia, or look?
Yes, I think that would be not possible. This will be a limitation of our meta-analysis, because we have studies that report only about the existence or non-existence of one factor, but in most of the cases we do not know enough about the confounding factors. So this is why I'm saying that we can tell conclusion about the individual effect, but definitely not the independent effect.